Well, welcome everyone to Don't Let Vendor Solutions Lead to Compliance Problems. Thank you all so much for joining us. Our moderator for today's call is Jill Brooking. She'll be answering the questions that you send through Q&A today. We'll try our best to answer all of your questions, but if for whatever reason we're unable to get to your question today, please follow up with your advisor for further assistance. Today's presentation is being recorded. We'll share the recordings in the follow-up email and on the NFP website. If there's any portions of this call that you missed, by Monday, you should receive an email with a link to the full recording. The PowerPoint slides used during this presentation will also be shared in that same email. At this time, I'd like to introduce our speakers for today's webinar. Joining us today are Chase Cannon, SVP, Deputy Chief Compliance Officer, Benefits Compliance with NFP, and Linda Gall, AVP, Account Management and Benefits Compliance Specialist with NFP. We're very excited to have them speaking with us today. It's my great pleasure to hand the call over to our speakers. Chase, the floor is yours.
Thank you, Leo, and thank you everybody for joining the call today. I know it's in the middle of the dog days of summer, and if you're anywhere close to Austin, Texas, it's over 100 degrees today. So maybe it's a good place to be in your office in front of the computer with the air conditioner on. But we're grateful that you're here with us, and we're glad to be talking about an interesting topic and one that has created some very interesting compliance issues, and that we know a lot of employers are out there being solicited or being called or being consulted about these vendor solutions. And we're going to talk about exactly what those are. And so thanks again for joining. Super glad to be on with Linda today. Linda's a longtime colleague and friend, and it's her debut with our Get Wise Wednesdays to have her join us and give her perspective, both as a benefits compliance specialist and with her specialty as an account management. So great to have you, Linda, and we're looking forward to this discussion with everybody. Just so you know who you're talking to, we have our introductions here with myself and Linda, and my picture is a little bit fuzzier than Linda's. And but we're both happy to be here, and that now you know what we look like. So happy to meet everybody. Our standard sort of disclaimer here that this presentation is meant to be used for general guidance only. It's not intended to be constitute tax or legal advice, and any question of application of the law should be directed to tax or legal counsel. And of course, our date today, August 17th, our information is current through here. So with that, let's look at our agenda today. We're going to go over and sort of do an overview of what we're talking about when we talk about vendor solutions. And you'll see this point solutions, vendor point solutions. We wanted to try and capture the different names that these programs might go by. And so we'll do an overview of what we're talking about and look at some of the examples of types of vendor solutions or point solutions that you might be seeing out there. We're going to go through some acronym soup with our federal laws that could apply. And we'll start and focus primarily on the big four that we kind of refer to them to with ERISA, COBRA, HIPAA, and the ACA. But we'll be talking about some other laws as well. And we'll go through some practical solutions to those laws. Then we'll finish by talking about the impact on HSA eligibility, taxation, always fun, how that works, and then reporting requirements relating to these vendor solutions. And then we have some fun takeaways at the end. So we'll get to those as well. Okay, so jumping in with our overview of vendor point solutions. Sorry, I'm having trouble making my slides advance here. So what are we talking about when we talk about a vendor point solution? And we threw a couple of definitions up here, but really these are sort of, think of them as add-ons or supplements to or enhancements to the employer's major medical plan. And so we wrote it here as point solution programs. These are specific vendor solutions that add value to an employer's major medical plan. They're a recent popular trend in employee benefit offerings, and that's why we're sort of on today, because of the trendiness of them. They are super helpful, and they often do enhance the plan quite a bit and provide sort of add-on benefits to the medical plan, and those are always appreciated by employees and are always a way that an employer such as yourself can sort of enhance the benefit offering overall. And so what do those look like? Usually these enhancements, they come in sort of a electronic or digital solution, an app, something that you can access on your phone as an employee and access additional health professionals, health education. But they range from a specific condition management to overall benefit program simplification. But we are seeing these primarily in the digital space, just as a way to provide that ease of access. Usually these are coming through third-party vendors, and that's kind of where we get the term vendor solutions. But that's sort of where they're generated from. The premium related to this is usually paid by the employer, and that can be the premium. Sometimes we're referring to a PEPM. It could just be a flat dollar amount and operate like a premium, but mostly the time it's just a PEPM, and almost in all cases is something that the employer picks up. So that would be the premium, the amount that you pay to access the benefits. Now, some situations, because it's medical care, and we're going to talk a lot about why it's medical care, but in some instances, this could be paid by pre-tax method through a Section 125 plan by the employee. So we'll see that most of these vendor solutions or these point solutions are going to be considered medical care, and therefore that is an option. But the way we're seeing it mostly structured is that the employer will pick up the cost or the premium or the PEPM so that employees can have access to the program itself. On the right there, and we'll get on the next slide, we'll see some examples here, but we have sort of a picture there with another definition. A point solution is a specific service for a specific condition. Chronic condition is an example to fill a gap in the healthcare plan or system. So that's kind of what we're talking about. As far as examples, these can come in all shapes and sizes again, and they can address a lot of different health conditions and concerns. But the most common ones that we've seen are musculoskeletal, which is how we have our skeletal muscle guy here on the picture. Musculoskeletal, fertility, developmental disability, mental health, and behavioral health. And there are others as well. And so you'll see these in lots of different forms and lots of different structures. And we'll talk about why the form and the structure and the benefit matter when it comes to the application of the compliance laws like ERISA and COBRA. But Linda, I'm going to pop it over to you now that we've talked about kind of a few of these different types of examples and kind of got a general idea of what these vendor point solutions are. To kind of walk through some of the compliance considerations and overall considerations when it comes to these point solutions.
Thank you so much, Chase, and thanks for the warm welcome. I think in our presentations, we often try to present materials in what's gently referred to as a crawl, walk, run fashion. And that's, of course, meant to suggest a natural progression of the learning experience. But as you know, the world of compliance can be somewhat unforgiving, sometimes brutally so, about the crawl and walk phases of development. And you frequently need to hit the ground running. And, you know, if you're attending a compliance webinar in mid-August, my guess is that you're already moving at a fair clip. You weren't shy on this slide about starting with a picture that tells you right away that there are several different compliance rules to consider as you enhance your employee benefits program with what we call point solutions. But our emphasis, even as we get into the details of these separate components, our emphasis will be on your goal of helping you truly enhance your benefit program. That's what you're trying to do, to deliver a value to your employees with the fewest compliance, we'll call them inconveniences, with the fewest compliance problems. And so we'll focus our attention there. Next slide. So what are the themes that we're going to cover today? We'll talk about eligibility for a point solution program. Do you want to offer it to all of your employees or only to employees who are enrolled in your medical plan? Because many point solutions, not all, but because many are considered medical care, it's going to be critically important to integrate the point solution with your medical plan to simplify your compliance. There are risks involved if you try to maintain them separately, and we're going to talk about that with a certain pronounced emphasis on encouraging you to integrate them if the point solution does indeed constitute a medical benefit. Sometimes the point solution vendors don't consider their solutions insured products, and that creates a bit of a tension as you're trying to implement and then administer these programs. For instance, you may be integrating the point solution into your medical plan and offering it to your medical plan participants and baking it into your ERISA plan documents and your WRAP documents, but the vendor might not be sending you a Schedule A. So we're going to talk about what you do with that and how to fix some of those issues. And then we're going to underscore, as we always do, the importance of seeking assistance from outside counsel. Many of the issues at the heart of this are very much legal issues. And as your benefits consultants, our job is to advise you of those things, but not to provide the legal advice itself. I will turn that back to you, Chase.
Yeah, thanks. So these are great themes to keep in mind as we're going through, and we'll circle back as Linda and I are going through this on these themes as a reminder of why they are sort of thread throughout all of this discussion. So we wanted to point them out up front, but thanks for walking us through that. So let's jump into ERISA, COBRA, HIPAA, and the ACA. The ACA there is the Affordable Care Act, or healthcare reform is sometimes it's referred to, or Obamacare. But these are the four big laws that really come into play when you are offering some type of group health plan offering to your employees. There are more, unfortunately, there are more laws and other laws. The list goes probably up to 14 or 15 different laws that could potentially be in play, but these are the big four that we're really going to focus on and really where the biggest stumbling blocks are. So why do these laws apply, and what sort of triggers them to apply? And just, I guess, really quickly to remind you of what the high level ERISA, this is what we're talking about with Form 5500. That's a requirement under ERISA. We have to have plan documents. We have to have summary plan descriptions, or SPDs. And along with ERISA come fiduciary obligations. Those are the obligations to sort of operate your plan according to plan docs and to do things in the best interest of your employees when you're operating the plan, and make decisions that are good decisions and will help plan participants. So that's ERISA. COBRA is that law that requires continuation after somebody terminates from employment if they were enrolled or they experience a different COBRA event. So there are notice requirements under HIPAA, under COBRA. HIPAA is a privacy law that keeps information, protected health information or private information, safe. And so if you are seeing that information, you are required under HIPAA to sort of build protections around the information on your servers and your emails, and make sure that nobody is seeing that information that shouldn't be seeing it. And obviously you're not allowed to sell that information or do anything that we as a reasonable employee wouldn't want any of our employers doing. So that's HIPAA. And then the ACA has lots of different requirements under it. And we'll talk about two that are really important here in a minute. But all of those laws apply when you are providing a group health plan. And when we're saying group health plan, the key to knowing whether you actually have a group health plan is whether that health plan is providing medical care. And that's why we're so focused on medical care here, because a lot of these vendors are not going to be calling these group health plans. They're not going to be calling them ERISA plans or COBRA plans or, plans meant to satisfy the ACA employer mandate. They're going to be calling them add-on solutions or supplemental benefits or point solutions. And so that can confuse people in that they don't think right away, this is yet another plan that I have to think about ERISA and COBRA and HIPAA and the ACA. But it all comes back to whether the benefit provided under a particular offering is considered medical care. And when we look at that, the definition of medical care, which we have on the screen here, is very broad. And that's why it pulls in a lot of these point solutions. But just to read through it really quickly, medical care is broadly defined to include amounts paid for the diagnosis, cure, mitigation, treatment, or prevention of disease. You can always already feel the broadening there going on. And then it gets even broader, or for the purpose of affecting any structure or function of the body. And so really you have many words there, but all of the words are expansive, right? These are words that you can that pull in all sorts of benefits, all sorts of services, all sorts of items. And so what we'll see is if we're talking about a fertility solution or musculoskeletal, where you're talking about giving advice about, stretching or general information on, how to get stronger, that's going to fall in to medical care because it's just it's so broad. So we'll get to some examples here in a second, but that's really the key that we're focusing on. And whenever we're looking at these point solutions, we're looking at whether they provide medical care. And if it does, that means these four big WAs, ERISA, COBRA, HIPAA, and the ACA apply. And what does that mean? That means you have to do all those things that I just said, fall under each of those laws. And presumably, and we'll talk about this too, presumably you already are aware of those requirements and could potentially fold your compliance in with your major medical plan compliance. But this is really the analysis we go through. Are the benefits provided under the point solution considered medical care? So let's look at a little bit more in depth to know whether medical care is being provided under these programs or solutions. If you have a licensed physician, that's just the fact that it's a licensed medical profession is going to be an indicator that you're getting closer to medical care. But you just kind of think high level here on the left, licensed physician or medical professional providing a diagnosis, a treatment, and or a prescription to an employee's specific condition. And so let's look at four factors that we really go through. The first is whether the physician or therapist is a trained and licensed medical professional. And so that's kind of number one. Are the individuals, and sometimes they're called coaches, and sometimes these programs get creative on what they're calling them. But you really have to look at what is that individual, that coach. Are they a licensed or a trained medical professional? That's one indicator. If so, you're getting closer to medical care. The second is whether the physician or therapist is actually making a diagnosis. In other words, are they looking at the symptoms or the criteria that are being brought to them and coming to a conclusion on what the illness or disease or condition is, or are they just responding to someone who has self-diagnosed? And we'll see this in the example we're going to look at in just a second. But if the physician is actually, or therapist or coach, if they're actually making a diagnosis, that's much closer to medical care. The third is whether the advice or the direction offered through the program is specific or individualized to the employee. Are they responding directly to the employee and providing that advice to the employee? Compare that with broadly related, they're giving broadly related information to the general condition the employee is seeking to address. And we'll see this in an example in just a sec, but looking at that specific individualized versus generic type of information that the coach or the program is providing. And then the fourth factor is whether there is any specific direction or prescription specific to the individual employee. Again, this is looking at what is the level of individualization that is going on with the benefit coming back to the employee. If we're going to have something with general suggestions or prescriptions that broadly pertain to the condition itself, that's going to be less likely to be medical care, whereas anything specific is going to be more. So let's look at a quick example, and this is kind of where hopefully the rubber meets the road here on understanding and hearing more detail about these types of programs. So let's just look at example 1 here. A program accessed through a mobile phone app asks John to verify whether he has a specific condition. And we're going to use the example of type 2 diabetes. John verifies that he has type 2 diabetes. As a response to John's affirmation of diabetes, the program gives John general coaching services about diet, exercise, and sleep habits that will be beneficial to reducing the risk of progression of that disease. So this type, if you'll notice, first of all, John self-certified, right, that he has type 2. There was not somebody on the other end taking in the symptoms, taking in the conditions and saying, you have type 2 diabetes. It was John coming and saying, I have type 2 diabetes. I already knew that. And then the information coming back from the program was general coaching services about diet, exercise, and sleep, not specific advice to John's situation or John's habits, right? And so this type of general coaching would not generally be enough to be considered medical care. So that's one example. In example 2, though, we'll do a little compare contrast here. Same facts, but this in this particular program, same facts, except that after reviewing John's eating habits, the physician or therapist provides specific advice, such as you should consume less soda, eat less sugar, eat more greens, and take a particular prescription drug. That type of specific advice would be a treatment or prescription for John's particular condition, and therefore constitutes medical care. So hopefully you can kind of see the shift there, just the way that the program is structured. And sometimes, to add a little bit of confusion, and this comes back to how the program is structured, some of these vendors will actually have 2 tiers of programs. And the first tier, if you took it and you paid less, maybe it's a little bit less money to get into it and is kind of level 1 of the program, you might be under sort of an example 1 situation where it's general coaching. But then the program also offers sort of a further in-depth level 2 type of program where they are getting more specific. They're providing more helpful, more individualized information to the employee, John in this situation. And then that, as you went into level 2 there, you would be crossing into medical care. So that adds a little level of complexity to how these are being offered. But the basic idea is the more individualized, if it's coming from a licensed professional, if it's diagnosing a particular disease and prescribing specific drugs, that's going to be considered medical care. So our conclusion and kind of where we are is that with these point solution programs is that by design, these are meant really to be helpful, right? They're meant to be additive to what the employer is already offering with their group health plan. And by design, they're going to have to go a little bit deeper than just generic to really be helpful. And so by design, we feel like these are addressing specific diseases, and a lot of them that we've seen require individualized diagnosis, treatment, or prescription services. And so we find it's very difficult to argue that these point solution programs are not within the purview of ERISA, COBRA, HIPAA, and the ACA. And again, that comes back to the fact, the idea that most of them are providing medical care. So that's how we wind up subject to these laws. Now, you will hear about this exception, but we don't think it's all that helpful. But I wanted to address it here because there's always kind of the general rule and then a bunch of exceptions, right? Or at least one exception. And in this case, the one you'll hear about is called an accepted benefit. And in this case, it's the so-called Employee Assistance Program, or EAP, accepted benefit. The challenge here is not only that the exception is difficult to satisfy, but it also is only an exception from the ACA. not from ERISA, not from COBRA. And so it's not all that helpful in that it just doesn't get you out of all the laws. But the challenge here, and we are probably not going to go through all 6 requirements to meet this exception, because the number one requirement here is that the program must not provide significant benefits in the nature of medical care, taking into account the amount, scope, and duration of covered services. And so the challenge there, and not to be all lawyerly, but we always focus on one word, and it seems like we come back to what's the meaning of that one word, and the one here is significant, right? Whether the benefits provided under this point solution program are significant in the nature of medical care. And again, we just think once you are doing any type of individualization, you have trained medical professionals offering benefits, that's going to be considered significant. And the other reason is getting back to the purpose of these programs, as we've gone to a few times, is really to enhance the medical benefit plan. And it's hard to enhance medical plan without providing medical benefits. So we won't go back through the rest of these requirements here for the exception, just because we don't think it is all that applicable, but we did want to mention it as one way you may see or hear these vendors try and explain away sometimes the ACA application. They'll call it an accepted benefit. And so we just wanted to raise that flag. So Linda, I wanted to flip it back over to you to kind of put a bow on this idea that these federal laws are going to apply.
Yeah, the federal laws apply. And so what do we do about that? Now we're going to move to there we go. What are the solutions? What are the practical solutions for actually ensuring that you can administer your plans in a compliant way, given that these federal laws generally are going to apply? And our number one answer, revealed on this slide, is integrate the point solution plans into your medical plan. And we emphasize it here in bold, large, all caps type. It almost looks like we're shouting, but that's not what we do. We inform. We want you to understand that while you may be tempted to offer these programmatic enhancements across the board to all your employees, including those who are not in your medical plan or may not even be eligible for your medical plan, your simplest approach, your least burdensome approach to compliance with the array of federal laws that Chase just reviewed will be to integrate the point solutions into your medical plan. And Chase, I'm going to turn it back to you to then explain how exactly is it that one achieves that.
Yeah, so here are some basic practical steps for each law. And the reason we broke it out by law is because each law requires different things, right? Different requirements. And there are different purposes for integration under each law. And so the first one, and you'll see actually the first bullet under both ERISA and COBRA are the same, because some of these things are the same, and we really want to highlight this. For ERISA purposes, integration means limiting the point solution program participation only to those enrolled in the employer medical plan. And so we talked about this as one of our themes up front, right? What is the eligibility going to be for these point solution programs? And many of the program vendors will push you, and it may be tempting because you want to provide the best benefits you can to all of your employees. But a lot of times the vendors don't think through what that means for purposes of federal law compliance. And in this case, for ERISA and COBRA especially, limiting the program participation to those that are sort of already under the purview of the group health plan, the major medical plan that the employer is sponsoring, helps eliminate this misalignment. So for ERISA purposes, it's everybody's already under the same plan. the second and third bullet points there, you add the point solution program to your plan docs, your RAPs, your SPDs. In other words, you're just describing this as another benefit that's available through the already existing group health plan. That just makes it a whole lot easier. You don't have to distribute SPDs to a bunch of new people that weren't needing to have an SPD before because they're not part of the group health plan. So just limiting it to the groups that you're sort of already dealing with or already helping administer the plan for really simplifies things from an ERISA perspective. For ERISA, you will have to add that point solution benefit to your Form 5500. We're going to talk about that in just a minute on another slide and how that works with Schedule A, because there's another theme. Many of these vendors don't consider their products insured products, which means they may not be thinking about Form 5500 as they're sending, and promoting these programs. So for ERISA, it's really just making sure that you're including those benefits in with the already existing benefits and then sort of wrapping it together as one big plan. For COBRA, same idea there with keeping it to the group that's already in the medical plan. And then including that program as part of the COBRA package. Now that sounds simple enough, but there are some administrative challenges that we listed on bullets 3 and 4 there under COBRA. Working with the program vendor and addressing this issue of whether somebody can participate in that program post-employment. Some vendors haven't thought through COBRA and may not even be aware that that's an issue. But also I think most vendors are flexible when it comes to who can participate. And I think the ones that we've talked to are amenable to this idea that, okay, you're treating it as medical care. We can make it available to a former employee that's on COBRA. The key for the vendor, I think, really is making sure that they're included in the PEPM fee, right? They're getting paid. But that's something to think through and make sure that you're on the same page with that vendor. The COBRA administrator needs to be communicated with, and this is the idea of including that point solution in COBRA election packets and notices. So the actual inclusion of the benefit here in the COBRA offering. There's 2 special COBRA challenges because COBRA is always special and always brings up interesting compliance challenges. But the first is determining the COBRA rate for the point solution. That can be tricky. Most of the time, particularly for fully insured, we can rely on the carrier premium. It's fairly straightforward, but when you start clicking in on these or adding on these additional benefits, you got to come up with a way to determine that COBRA rate that's fair. And then most COBRA vendors can't administer COBRA directly for the point solution program. So that may need to be handled in-house. Again, getting back to that idea to work with your program vendor, work with the COBRA administrator and figure out how that COBRA offering is going to occur. HIPAA can be a challenge. We mentioned up front, what is HIPAA? It's that privacy law that says you can see information. If you're administering the plan, you're operating the plan, you can see sensitive information in order to pay claims and operate the plan. But for the most part, that information needs to be protected and kept safe. And so when it comes to particularly these programs that are structured as reimbursements, where you might see a name and a reimbursement amount for a particular service or a particular item that is medical care, that could be considered protected health information or PHI under HIPAA. And so you may have an obligation that you weren't aware of before because you've implemented this program. What does that mean you need to do? Well, you need to review HIPAA and run a risk analysis. A risk analysis sort of identifies where you could have potential leaks in your system where information could get out or where a cyber attacker could get in. And then making sure that you have policies and procedures in place to be able to know, so employees know how to protect that information, particularly on the IT and tech teams. So that's a bigger discussion and we could spend all day just on HIPAA, but it's something to consider. And sometimes employers wade into that without realizing, oh, I am doing a reimbursement. I am seeing an employee's name next to a medical condition or a service. And that means you're in the world of HIPAA. ACA, we mentioned this, ACA, integrating the solution with the employer's major medical plan, that will yield ACA compliance by virtue of the medical plan's compliance. So we're kind of jumping to a conclusion there and assuming that the medical plan is actually complying with the laws that it's supposed to. But the idea is that you already have sort of a group health plan that's in compliance with the ACA. You add this benefit in there, and now you've achieved compliance with the ACA. And the integration itself is achieved by adding the point solution program to the plan docs and the RAPs and the SPDs the same way you would do it for ERISA purposes. The last and bonus law that we're going to talk about here is MAPIA, and that's mental health parity. And that law has been around for a while. We've heard about it recently because of a new requirement that has to do with analysis. You as an employer have to show that you're complying with MAPIA, and that means you now have to produce this analysis if the Department of Labor asks, and the analysis looks at ways that you might be treating mental health parity differently than medical and surgical benefits. And so the challenge here is not to go too far down that road, but for mental health point solution programs, and many of these are aimed at addressing mental health, you just have to review your obligations. The key there is ensuring that mental health benefits are on par with medical and surgical benefits. So think about things like pre-authorizations that might limit access to mental health, things like additional cost sharing. Those are all traps to get in trouble if you're treating mental health benefits differently than medical and surgical. So those are kind of the solutions and the reasons why to integrate this point solution with your group health plan. It's just so much of a simpler road to compliance, and to kind of help highlight what happens if you don't integrate. And we don't like to focus on the negative. We want to focus on the positive, because these can be great solutions and the easiest is to integrate. But here's why non-integration is just such a challenge. The point solution, if you don't integrate, the point solution can be considered its own group health plan. And so that means you have to have in place its own plan docs, SPDs, and file a Form 5500. So there's one thing that you would have to do in addition if you didn't integrate. A bigger one that comes with bigger penalty amounts is the ACA's annual dollar limit prohibitions and the preventive services requirements. A non-integrated plan, so you just think about this program, a vendor program on its own, is not going to be providing things like annual exams and immunizations for free to its participants, right? That's a requirement under the ACA, and that's what we refer to when we say the preventive services requirements. In addition, that plan on its own will have a natural built-in annual dollar limit. And so that's another violation of the ACA, and those come with big penalty amounts. That's one reason when we talked about that EAP exception, if you did fall under that, you would get out of the ACA, and that would help with this challenge here, but you'll see the other challenges around it. But that's another major reason for integration. For HIPAA, it's very difficult to implement policies, procedures, and to build in safeguarding for that PHI. And so that's a huge challenge and can be a big project on its own. If you vary the eligibility for these point solution programs and offer it to the non-medical population, we mentioned this misalignment. Now you're going to have COBRA challenges due to that misalignment of coverage. You have a new population of employees that you were never considering before, who could now be eligible for COBRA when they are terminated. So that's another challenge. And then we did want to throw on this, and this is where I'm going to pull Linda back in a little bit, but we already sort of have a comparison here when it comes to flu shot and COVID vaccine programs that are administered directly by employers. That's just another example of a benefit that's being provided outside of the group health plan usually, and opened up to all employees through a wellness program. And it's an issue that hasn't been widely addressed or acknowledged, and definitely has not been addressed by the government with any type of guidance on whether that's a group health plan and how you achieve compliance. We bring that up not to scare anybody or to make anybody worry if you do have a flu shot program, and we know this is the time of year where those are coming back online or getting close to that. We bring it up as kind of an analogous type of benefit to help illustrate the compliance challenges. We think that there's probably very low risk with that, just because we have not seen any enforcement activity of an employer just trying to administer flu shots to its employees. And we think that the government would publish some meaningful guidance before they started enforcing it. The other reason we think it's probably low risk is because you're actually helping people try to stay more healthy by giving them flu vaccines or flu shots or COVID vaccines, right? You're not hurting participants, and they're willingly coming and doing it. It's not like you're forcing them to do anything. And so in that way, it's promoting health and promoting employee health. And so we think probably low risk on any type of enforcement there. Linda, anything to add there as we kind of shift into a related area with HSA eligibility?
No, I think you covered it nicely. Just a broad reminder through all of this that as you consider these programs, or as you are reminded of other programs you might already be running, like flu shot programs, keep reaching out to your NFP benefits consultant for guidance on it. That is what your teams are here for. And we very much want to help and assist you as you navigate the no good deed goes unpunished world of benefits administration.
Great. Well, take us into HSA eligibility, because that's another huge challenge here with these point solution programs, Linda.
Yep. So health savings accounts, HSA eligibility is potentially adversely affected by some of these point solution programs. And that gets at the issue of whether or not the programs constitute impermissible coverage. So many employers over the last decade, 15 years, have implemented qualified high deductible health plans that allow their employees to participate in health savings accounts, HSAs. But there are restrictions on those. And in order for an employee to remain HSA eligible to make contributions into or receive contributions into a health savings account, they cannot simultaneously be receiving something that constitutes impermissible coverage. So what is impermissible coverage? Well, it's any benefit that the plan pays before the employee has met the statutory minimum high deductible health plan deductible. So if the point solution that's offered by the employer is offered, if there is no cost to the employee to purchase the service itself, for an employee who uses the service, if the service is offered for free, that is potentially impermissible coverage and would disqualify an HSA somebody who's otherwise HSA eligible from being able to continue to participate in their health savings account. So we want to be very careful as we're evaluating point solution programs in an environment where you're purposefully offering high deductible health plans in order to enable people to participate in HSAs. We want to be very careful to make sure that the point solution program doesn't interfere with that. And I know it looks on its face from this slide that that's going to be a problem, and we're not going to give you a problem without providing a solution. So Chase, I let you take it to the next slide.
Now that'd be quite rude to just drop bombs, right?
Yeah. So there's a problem we can't solve. Bye.
So let's look at some of the potential solutions. And again, the idea here is that these can be helpful to your employees if structured properly or if administered properly. And so one of the solutions here would be to simply offer the program only to those employees enrolled in non-high deductible health plans or non-HSA qualified high deductible health plans, right? sometimes an employer will pair a high deductible plan with an HRA. Well, this is not going to be an issue there because you're not trying to preserve HSA eligibility. So just, again, going back to that common theme of who's going to be eligible for this point solution program, this may be one way to simplify your administration, is just say, look, if you're in a qualifying HDHP plan and we're trying to promote and build out this HSA for our employees and allow them to contribute to their HSAs, we're just not going to mess with that. Let's just leave it as is for those people. And then we'll add this benefit for anybody else in a non-high deductible plan or a non-HSA qualified high deductible plan. That does require an eligibility provision amendment in the related plan docs. We don't want to go overlook that, but that's one solution and probably the cleanest. The one that probably helps the most, though, is to build program benefits into the plan, again, through integration, and then charge employees the fair market value for the benefits. And so just think about what would that benefit cost? And then the employee helps with the cost sharing, and that applies towards the deductible. And so that gets around this idea that the employee is getting a free or a no cost benefit that is, covered under the statutory deductible, because now the employee is paying something for it. So another way to say this is the program benefits are treated as any other benefit under the plan that employees have to pay some amount for them until the employee meets that deductible. A quick note here, and part of the challenge, there's no specific guidance on how to determine fair market value. It just needs to be justifiable. And then a quick note that the IRS has not formally blessed this. This is not like the IRS says this is the way around it. Unfortunately, on a lot of these issues, because many of these plan designs are new and the government is generally behind on addressing them, we just don't have a specific IRS notice or blessing on that particular option. But it seems to be an acceptable option. We've vetted it out with lots of different industry resources, and it seems to be one way that everybody agrees would satisfy the rules. Some exceptions, there might be an exception here, and so you don't have to worry about the possible solution. One is that if they are insignificant, remember we're being lawyerly, what does that even mean? It's insignificant or preventive benefit exceptions. This actually is outlined in IRS guidance that basically says, like, if benefits are considered insignificant or preventive, then they won't impact the HSA eligibility. And so this is a little bit like that EAP exception. And that's another reason we included that EAP exception slide here. So you can go back and look at that, but it gets back to this idea. What does that even mean to be insignificant? We think many of these benefits are crossing over that line into significance. And again, why would you want to offer it and enhance your benefit plan if it weren't significant? So getting back to that idea of why would you want to offer these overall? But that's one exception. The other probably is more helpful, at least through the end of this year. We can always hang on to 2022, right? This is the telehealth exception that basically the IRS has said that employers can rely on this telehealth exception to preserve HSA eligibility, which means all program benefits that are coming through telehealth, even if they are underneath the statutory minimum deductible, won't impact HSA eligibility. We're hoping that gets extended, and we're hoping that we can rely on that past 2022, but it is an exception that could be out there. With that, let's shift to taxation, because I know how much everybody loves tax and taxes, but there are some challenges here when it comes to taxation, and this definitely comes back to the plan structure and the benefit that's being provided. And so far, we've focused really directly on most of the benefits coming through as medical care, or being determined from a legal analysis that they're medical care. That's important, and it's actually helpful on the tax aspect, because if you're providing benefits to an employee that are medical care, either through a program, through insurance, or direct reimbursement through something like an HRA, if you have your own HRA that's reimbursing expenses, those can be excluded from the employee's gross income because they're for medical care. And so that's helpful. The challenge here is that some of these point solution benefits are not going to be considered medical care or at least part, it might be divided up where part of the benefits are medical care, but then the program goes further and provides something like a temporary egg storage. And that's where we've seen the biggest challenge on this. That part of the program or that benefit is not going to be considered medical care. Let's caveat that because it's a little bit more nuanced, but the temporary egg storage expenses could be considered medical care if they're to treat infertility. But if they're not, if they're long-term storage, typically greater than 1 year, that's not considered medical care. So it's when we start getting into these elective type of benefits, long-term storage. There's some guidance in IRS publication 502 that basically says, look, this is too far removed from the actual medical condition that the storage is trying to treat. And therefore, we're not going to consider it medical care. And so if the program is providing something like that long-term egg storage, that is something that needs to be taxed to the employee. In other words, the employee cannot exclude that from their gross income because it's not medical care. The challenge here is the employer may not even know which employees are receiving the benefit, right? If the vendor is just paying for it and all the interaction is going through the digital app or the direct from employee to vendor, the employer might not even know. But the cross challenge there is that the employer is a responsible party in reporting an employee's gross income. And that's usually happening on the form W-2 and as part of the payroll process with tax withholding, right? So that illustrates a challenge where employer might not have enough information to even know to tax. And then even if they do know, how do they coordinate with the vendor and how do they work with the payroll provider to make sure that amount is added to the gross income of the employee receiving that long-term storage of an egg in that example. So some quick solutions. Again, we don't like to produce problems without solutions. The two best solutions we've seen on this one: program vendor communicates the benefits back to the employer, and then the employer reports it on the form W-2, either directly if they do their own payroll or through their payroll provider. Now, a quick caveat there that we have to be sensitive with that. That's an example of perhaps, and it would depend on the information, but you're starting to get into employee sensitive information, right? If it's not medical care, it's probably not going to be HIPAA, but you still have information that needs to be kept private. Vendor issues a 1099 directly to the employee would be the second way to do this. You just have the vendor send something directly to the employee because the vendor already knows. Again, that's not something the vendors are always thinking about, and highlights are another theme, which is communication with the vendor on some of these issues. And on this one, it would be critical to work through that and make sure the vendor is actually doing that if that's how the employer wants to tackle it. Our last section here is on reporting requirements. And then Linda's going to give us a great summary and some takeaways. So bear with me. I'm like the detail lawyer guy, right? That brings all the bad news to you. And Linda's going to bring us home with all the good news and the takeaways. But this is the last slide of things to worry about. ACA Form W-2 reporting. And this idea is regardless of that tax issue that we just talked about, right? The fair market value of the benefits and services have to be included in that aggregate reportable cost. That's the ACA Form W-2 cost of coverage reporting. If we're getting technical and you're really interested, it's reported on box 12 under the code capital D, capital D. And so most payroll providers are aware of that requirement. It's just, and it's happening for most employers that are subject to that requirement. It's only if you have 250 or more W-2s, you would have to comply, but that's just the idea of getting that information to your payroll provider so that that reporting requirement is taken care of. The P-Core fee, this is an ACA requirement as well. P-Core is the fee that we thought was going away, but has been revived and is in play until 2029. But if the program is providing medical care, then the enrolled employees have to be included in the covered life headcount for that annual P-Core fee reporting. And then we wanted to highlight for fully insured plans to take note here, because some of these point solution programs are structured as a reimbursement And that's similar to an HRA. And HRAs are considered self-insured plans, and that means a PCOR fee is due. In the self-insured context, the PCOR fee is paid by the employer. And so fully insured employers may not even be aware of the PCOR fee, may just know that the carrier is handling it, because that's how it works for the fully insured medical plan. The carrier is on the hook and paying that fee. But for a self-insured employer, and again, a reimbursement structured point solution program might be similar to an HRA. That means the employer would be on the hook. So a note there. And then the last requirement here is for ERISA Form 5500. We mentioned this up front, but vendors are probably not considering these as insured products. That means they probably won't provide a Schedule A. Does that mean you are out of your Form 5500 requirement on this particular benefit? No, unfortunately. Thankfully, there are some special Form 5500 instructions that the DOL graciously provided to help with filing where the situation arises where there's no Schedule A. So the idea there is that the point solution is not integrated, and you have to file a separate Form 5500, or if you're including this as an integrated benefit, how do you describe those benefits on Form 5500? So with that, Linda, take us to some summaries and takeaways here.
Happy to do that. Listen, we titled the presentation with an instruction: don't let vendor solutions lead to compliance problems. And I'm going to add a few other things to that. Don't be scared of the acronyms. Don't let the acronyms scare you. Don't let the point solutions scare you, and don't ever stop putting the real life needs and real life interests of your employees first. I hope that in this presentation, we've covered some of the key things that are going to help you simplify the compliance obligations that are attendant on these point solutions. Many of the point solutions are of enormous value and interest to your employees, and that by extension makes them of enormous value and interest to you. And we very much want to help you implement and administer them and remain compliant throughout. So back to the basics. It's where we started, it's where we'll end. You're going to need to think about confirming your employee eligibility, whether you want to cover everybody or only the people in the medical plan itself. We talked about some of those issues. Integrating the point solution with your medical plan is always going to be the simplest way to achieve maximum compliance. If you have high deductible health plans, you want to consider the impact on employees' health savings account eligibility. Whether or not you're currently self-insured or fully insured, if you adopt one of these programs, you very likely are going to have PCOR fees that you're going to need to think about. Chase also talked about some of the taxation and reporting obligations. We're going to encourage you to keep working closely with your vendors on the COBRA issues, W-2 reporting, Form 5500, and certain other administrative details that are just part and parcel of the lived experience of this. And last but not least, seek assistance. Don't be shy. Seek assistance from your NFP consultant and of course from outside counsel where that's often warranted. And thank you very, very much. And I would say the other piece is avail yourself of our NFP publications. That's why we put that slide there. We have a really nice publication specifically on point solution programs. If that's not already in your hands, reach out to your benefits consultant and we will get that to you quickly. It also references other publications that will likely be of interest to you, at least we hope so. And we thank you very, very much for joining us today. Really appreciate you taking the time to explore this important topic with us. Always reach out to us with any questions that you might have, as well as for copies of the publications. And now I will turn it over to you, Leah. Well, first, let me thank you, Chase, for having the laboring oar on some of the more technical stuff, but it is just so important. And we think you do it really, really well. And now I'll turn it over to you, Leo, and ask you to close us out on time and under budget.
Well, thanks, Chase and Linda, for sharing your time and expertise with us today. To reiterate, today's presentation was recorded. We'll be sharing that recording in the follow-up email and on the NFP website. If there's any portions of this call that you missed by Monday, you should receive that email with a link to the full recording. The PowerPoint slides used during this presentation will also be shared in that same email. At the end of this call, a survey will populate in a new window. If you could, please take a brief moment to complete that survey, as it lets us know what topics are important to our listeners and helps us to make our education program as current and relevant as possible. That concludes our webinar for today. I'd like to thank everybody for joining us. Have a great day.